Hello, my name is Bruno Sangro and I lead the liver unit at Clínica Universidad de Navarra in Pamplona, Spain. In the following 5 minutes or so, I will summarize for you the results of a novel immunotherapeutic approach to liver cancer and viral hepatitis that we have recently published in the Journal of Hepatology. This was the first clinical trial to ever study the anti-tumoral and antiviral effects of anti-CTLA-4 blockades in patients with hepatocellular carcinoma and hepatitis C virus infection. Cytotoxic T lymphocyte-associated antigen 4, or CTLA-4, is expressed in the surface of T lymphocytes. Upon binding of the co-stimulatory receptor B7, it sends an inhibitory signal that serves as a natural brake for T cell activation. Hence, CTLA-4 blockade releases these brakes and enhances T cell activation and proliferation through various mechanisms that we still don't know in depth. And tremelimumab is a human monoclonal antibody that blocks CTLA-4 and has proved to be useful in the treatment of melanoma. On the other hand, cirrhosis due to hepatitis C viral infection is the main cause of hepatocellular carcinoma in European countries. So we thought patients with hepatocellular carcinoma due to hepatitis C infection were in fact a unique model in which the dual antiviral and anti-tumoral effects of tremelimumab could be studied for the first time, and that is exactly what we did. Together with 2 other hospitals in Spain, Hospital 12 de Octubre in Madrid and Hospital Reina Sofía in Córdoba, we studied in a group of 21 patients the safety and efficacy of tremelimumab given at a dose of 15 mg per kilogram every 90 days. The population was mainly patients with advanced tumors that had relapsed or progressed to at least one previous anti-tumoral therapy, and nearly half the patients were in Child 2 Class B. All patients were infected by hepatitis C genotype 1b, and most of them had never been treated with antivirals. At the beginning, safety was a major concern during the design phase because of the possibility to induce a flare of hepatitis and because of the frailty of the cirrhotic patients. However, treatment was globally well tolerated. Most adverse events were mild or transient. The most frequent one was an itching skin rash, and there were no treatment-related deaths. A remarkable rise in serum transaminases occurred after the first dose in more than half the patients, but was not associated with a parallel decline in liver function and did not recur in the following cycles. Among the 17 patients that were evaluable for tumor response, 3 had a partial response and 10 had stable disease, accounting for a disease control rate of 76%. And nearly 40% of tumor had a tumor response by alpha-fetoprotein. Importantly, these responses were durable. Partial responses lasted for 3.6, 9.2, and 15.8 months, and 45% of stabilizations lasted for more than 6 months. In fact, in an intention to treat analysis, the median time to progression was 6.5 months, which is remarkable. On the viral sites, results were even more appealing. Tumor progression was and not viral outcomes decided whether the treatment was withdrawn or not. However, tremelimumab induced a consistent and progressive decrease in viral load, and 3 patients had a transient complete viral response during follow-up. The effective antiviral immune stimulation translated into an increase in the number of virus-specific interferon gamma-producing lymphocytes that were observed post-treatment. And the analysis of quasi-species showed that new emerging variants replaced those predominant variants present before therapy in those patients with a more prominent drop in viral load, further illustrating the immune pressure that was put on the virus. Globally, our results indicate that tremelimumab has intrinsic antiviral activity against hepatitis C viral infection. And in this small population of patients with hepatocellular carcinoma, they also strongly suggest that tremelimumab has in fact significant anti-tumor activity. These results clearly warrant further investigation of tremelimumab or other immunostimulating monoclonal antibodies. It is not the end of a story, but hopefully the beginning of an era of new drug development that may fulfill the unmet need for better systemic treatments for hepatocellular carcinoma. Thank you very much for your interest.